With flu season right around the corner, it is important to know how to reduce the risk of contracting it and how to combat it. And joining me now is Dr. William Jacks of Premium Family Care, a contracted provider for the Optum Care Network Nevada, the sponsors of this segment. Welcome, doctor. I have so many questions for you. I hope you're ready.
Thank you for having me.
The flu is coming. We all know it's coming. What is the best way to combat the flu?
Well, like you're saying, the flu is coming. The season starts right now in October. It's going all the way to May, with the peak seasons between December and February. The first thing you want to do is probably try to avoid getting close with patients that have the disease, patients that are sick. Wash your hands constantly. Those are the things that you can do to prevent the flu.
And a lot of people recommend the flu shot. Every year they say, get your flu shot, and that's usually the best guess as to what the strain is going to be. But now I'm hearing we have a triple threat to worry about: the flu, COVID, and RSV. Is this something that we should make sure we get vaccines for all three of these things?
Yes, I think so. The CDC guidelines regarding the flu is to get everybody vaccinated that is 6 months and above.
Okay.
It is important, especially for people who have chronic risk factors, such as patients older than 65, diabetics, patients with respiratory diseases such as asthma, COPD, and emphysema, and also patients with diabetes. So we strongly, my role as a physician is try to educate my patients, try to provide the vaccine, whether it's at my office or at the pharmacist. So that is critical.
So if you are going to get vaccinated for all three, is that something that you can go in one day and get all three vaccines at the same time? Is that something that we need to look at spacing out? What would you recommend?
Well, ideally you want to try to avoid getting all the vaccines together. The RSV, for the respiratory syncytial virus, is very new. I mean, this is the first year that we want to have that vaccine, and apparently it's going to be just a one-time shot, which is great.
Okay.
Okay, but the RSV and the flu vaccines, you can get them both together the same day. But ideally, I would recommend to wait at least a few days, a week, to get the COVID vaccine, because sometimes with this vaccine you're going to have some side effects. So you're trying to lower those side effects, trying to space them out.
When you recommend people getting the flu shot, do you say now is the time? Do you think we should wait? You mentioned October. Should we wait until next month before we get it? When's the best time, in your opinion?
Well, I think the best time is now.
Okay.
I mean, some pharmacies, they have it already. Some medical offices, they still don't have it. But I think it's important, the sooner the better, because that's a way. I mean, you still can get the flu, even if you get vaccinated. But obviously, the symptoms are going to be much less. And you're going to also be able to prevent hospitalizations and, the burden in the hospitals. And so it's a very serious disease. We just didn't realize how serious the flu is, and patients, unfortunately, they still don't realize how serious it is. But the death rate with flu is almost as similar as a COVID last year.
Wow, so it's really important to take these preventative measures, and like you said, wash your hands. That is the biggest thing.
Very, very important.
Thank you so much, doctor, for such great information, and thank you to Optum for sponsoring this segment. They have locations across Nevada, and you can give them a call at 1-855-780-5954 or visit their website at optumcare.com/Nevada.